to talk a little bit of family planning here, and he mentioned it's a good idea you ought to see your primary care provider to get some basics done before you think about starting a family.
As soon as you decide that you're getting ready to have a baby, have a family, it's important to come on in and get a good physical, do some basic labs, so we can identify any problems beforehand, and then maybe talk about diet, exercise, cutting out those things that are not good habits, such as smoking, drinking, a lot of caffeine consumption, that kind of thing.
It's also a good time when you can talk about picking an obstetrician, picking a pediatrician,
Absolutely.
Picking a hospital.
Absolutely. Usually patients will have the hospital in mind, and then we'll kind of go from there as far as the provider, and then we also talk about pediatricians as well. A little bit later, but sometimes it comes up.
All right, now that's about starting a family.
Right.
But if you're trying to prevent a family and doing some birth control pill, there's some new options out there.
There are some newer options.
IUDs, Mirena is one of them. Am I saying it right?
Mirena.
Tell me about
Yes.
it.
That is a birth control option that contains 20 micrograms of progestin. It is a progestin-only birth control option. It is an intrauterine device, and we place that in the office. This is a picture, or this is an actual one. That's the Mirena IUD. The other one that's very, very similar to that is the Skyla. You can see they're very similar. The purple is the Skyla. It's a little bit smaller device. It's 18 micrograms of progestin.
And those really pretty small, inserted in the
small.
uterus to prevent pregnancy, but who might be a candidate for that?
So the Mirena is for patients that have had at least one child. The Skyla is good for those patients that have not had a child yet.
Okay. Now they have hormone in them, so there is some risk factors.
There are some risk factors with the Mirena. We typically use the Mirenas and the Skylas to help, obviously, with birth control, but to also control bleeding. A lot of patients come into the clinic and we find out after a physical history that they have migraines. Those are contraindicated in patients that have that are on oral birth control. So we talk about the progestin-only options.
And it's I won't say simple, but it is a procedure you can do in the office. It doesn't require sedation, doesn't require hospital.
No, not at all. We can do that in the office. Myself, Dr. Amanda Fox, and Dr. Hayslip insert these at the moment.
All right. Now there's also a new thing called Nexplanon. Am I saying that right?
Nexplanon, absolutely.
Right.
It was Implanon. They changed it just a little bit, and that is Nexplanon as well. This is what it looks like. It's a small rod that's placed inside the inner of the arm, right about here. And it is also progestin containing only.
So it just goes under the skin.
Just goes into the skin, absolutely.
Okay, and it is it's done in the office. And what's some of the risk factors, concerns about that?
Same thing as the Mirena and the Nexplanon. We use it for patients for birth control and for those that have a lot of trouble with bleeding, cramping, excessive bleeding during their periods.
Okay, now tell me how long these things last for. I think the Nexplanon,
they're a little bit different, absolutely. Yeah. The Nexplanon is good for 3 years. The Skyla, which is the smaller of the two, the Mirena, the Skyla is good for 3. The Mirena is good for 5. There's also the copper IUD, which is the Paragard. That is actually good for 10 years. There is no hormone in the Paragard IUD.
Okay. Now, we talked about the good thing, maybe decrease your period. It's good for birth control pill. It's done in the office easy, but what are some concerns or risk factors you might want to look out for?
You want to look out for, after you have it placed, you want to look out for embedding. So a lot of times we recommend that those come out before the 3 years, the 5-year mark. They have a higher risk of embedding into the lining of the uterus or perforating through the uterus. So anytime that you have excessive cramping, which you will have a little bit right after they are placed, but if it's excessive, you want to make sure that you come back into the office 4 to 6 weeks after that it's placed so that we can do a check and make sure you're doing all right.